Next, we have the condition as hematoma and seroma. So these often happens either as a result of injury or as a postoperative effect. So for that, we have special codes like 10140, 10140. And for acne surgery again, like margipulization or removal of acne. What is acne? An inflammatory lesion where there will be formation of papules or pustules, right, or comedones. So for that, you have 140 as acne. And then we have a foreign body removal code, again 10120. That is for a foreign body removal which is simple, and of course for a complicated foreign body removal, here the physician has to make dissection subcutaneously. He has to dissect the tissues in order to remove the foreign body. In that case, it goes for a complicated foreign body removal. Lastly, we also have a code for this puncture aspiration. Initially, we have for fine needle aspiration. The difference between a puncture aspiration and a fine needle aspiration is fine needle aspiration is being done to investigate the tissue, whereas a puncture aspiration is done to treat the condition, which is a cyst. And we also have a code for complex postoperative infection.